All India Radio presents Morning News. Good morning. I am Saira Mujtaba and with me is VC Pramod. The headlines. Country witnessing declining trend in active number of COVID-19 cases. Over 3,53,000 patients recover from the disease in the last 24 hours. Over 17 crore 26 lakh doses of COVID-19 vaccine administered nationally so far. National capital Delhi's COVID test positivity rate lowest since April 16 this year. Government squashes rumours that 5G technology is causing the spread of COVID-19. Centre delivering global aid to states and union territories through whole-of-government approach. Orissa to import vaccines for COVID-19. Global tender to be floated to procure COVID-19 vaccines from major national and international firms. In Andhra Pradesh, 11 COVID patients die in Tirupati due to lack of oxygen supply. In Tamarind, the 16th Legislative Assembly begins today. Assembly Speaker's election to be held tomorrow. In Nepal, opposition parties start preparations to form new government after Prime Minister KP Sharma Oli loses vote of confidence in lower house of the parliament. And in cricket, India to tour Sri Lanka in July and play 3 ODIs and 3 T20 internationals. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. Vaccination for persons between 18 and 44 years of age has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news. India is witnessing a declining trend in the active number of COVID cases. The Health and Family Welfare Ministry has said that the active cases comprise 16.52% of the cumulative positive cases. There are over 37,45,000 active cases in the country at present. As a positive sign, the COVID-19 recovery rate of the country is also consistently improving. As the country is registering more than 3 lakh recoveries daily over the past many days, the recovery rate has further improved to 82.38%. The Health Ministry has said over 3,53,000 patients have recovered from this infectious disease within the last 24 hours. The country has registered over 3,66,000 new COVID cases in the last 24 hours. The Health Ministry said a total of 3,754 deaths were reported in the country within 24 hours. Several states and union territories are still registering higher number of cases in the country. The country has administered a record of over 17 crore 26 lakh doses of COVID-19 vaccine so far. Yesterday, on the 115th day of the vaccination drive, over 24 lakh 30,000 vaccine doses were given. Over 5 lakh 18,000 beneficiaries in the age group of 18 to 44 years received their first dose of COVID vaccine. Over 25 lakh 52,000 such beneficiaries across 30 states and UTs have got vaccine doses since the start of phase 3 of the vaccination drive. Over 1 crore 60 lakh vaccine doses have been administered to the healthcare workers, over 2.18 crore doses to frontline workers, 6.25 crore doses to people above 45 years, and 6.9 crore doses to people above 60 years.
National capital Delhi continues to witness drop in new coronavirus cases as 12,651 fresh infections were recorded in the last 24 hours. 13,306 people were discharged during the same period and 319 fatalities were also recorded. The test positivity rate came down to 19.1%, which is the lowest since April 16 this year. On April 22nd, a positivity rate of an unprecedented 36.2% was recorded. The national capital at present has 85,258 active cases. Government has scotched the rumours that 5G technology is causing the spread of COVID-19. Ministry of Telecommunications has said it has come to its notice that several misleading messages are being circulated on various social media platforms claiming that the second wave of coronavirus has been caused by the testing of the 5G mobile towers. It said these messages are utter nonsense and absolutely incorrect. It urged the general public not to be fooled by fake information and rumors spread in the matter. The ministry said claims linking the 5G technology with the COVID-19 pandemic has no scientific basis. It informed that testing of the 5G network has not yet started anywhere in India, and the claim that 5G trials or networks are causing coronavirus in India is baseless and untrue. Mobile towers emit non-ionizing low radio frequencies and are incapable of causing any kind of damage to living cells, including human beings. Department of Telecommunications has prescribed norms for exposure limit for the radio frequency field, which are 10 times more stringent than the safe limits prescribed by International Commission on Non-Ionizing Radiation Protection (ICNIRP) and recommended by WHO.
The Union Ministry of Health has said that the centre has expeditiously delivered global aid to states and union territories through a whole-of-government approach. The ministry said 8,900 oxygen concentrators, 5,043 oxygen cylinders, 18 oxygen generation plants, 5,698 ventilators and nearly 3.4 lakh remdesivir vials have been delivered so far. It said effective immediate allocation and streamlined delivery to the recipient states and institutions is an ongoing exercise, and it is being comprehensively monitored on a regular basis. The Finance Ministry has said it is factually incorrect to state that there is no provision for expenditure on COVID-19 vaccination by the central government. It said the amount of 35,000 crore rupees shown under demand for grants titled Transfers to States in no way implies that expenditure cannot be incurred by the centre. Rejecting media reports, in a statement the ministry said vaccines have actually been and are being procured by and paid for by the centre through this head of account.
The Indian Air Force and Indian Navy are working tirelessly to provide logistic support to shore up medical supplies to tackle the current COVID-19 situation. The Indian Air Force aircraft carried out 534 sorties from various parts of the country, airlifting 336 oxygen containers of total capacity of 6,420 metric tons and other medical supplies and equipment. The Indian Air Force aircraft also carried out 84 international sorties, airlifting 81 cryogenic oxygen storage containers of total capacity of 1,407 metric tons, along with 1,252 empty oxygen cylinders, 705 oxygen concentrators, and respiratory oxygen raw material zeolite. The equipment has been procured from Singapore, Dubai, Thailand, United Kingdom, Germany, Belgium, Australia, Indonesia and Israel. As part of Operation Samudra Setu 2, Indian naval ships INS Airavat, Trikhand and Kolkata arrived back home with critical COVID-19 medical stores from friendly foreign countries yesterday. An Indian Air Force IL-76 aircraft today airlifted oxygen containers from Jakarta. Transfer of personnel of Indonesia's defence forces on completion of service courses in India was also undertaken. Indian Air Force continues to airlift medical supplies from France, Singapore, Amsterdam and within India. In order to address the surge in demand for oxygen, the centre has undertaken key measures to increase the availability, streamline the distribution and strengthen the oxygen storage infrastructure in the country. The Commerce and Industry Ministry said the steps undertaken focused on the entire oxygen supply chain, including efforts for improving oxygen production, enhancing tanker availability to optimize logistics, improving oxygen storage at the last mile, and easing norms of procurement. Oxygen availability has been enhanced by increase in production capacity and production, setting up of pressure swing adsorption PSA plants, import of liquid medical oxygen and LMO from overseas and procurement of oxygen concentrators. For enhancing tanker availability to streamline transportation, nitrogen and argon tankers have been converted, tankers and containers have been imported, domestic manufacturing of tankers increased, and rail and air transportation of tankers is being undertaken to reduce turnaround time.
The Shahi Imam of Delhi's Jama Masjid, Sayyid Ahmad Bukhari, has appealed to people to offer Eid al-Fitr prayers at their homes in view of the coronavirus pandemic. The Shahi Imam of the Fatehpuri Masjid, Mufti Mukarram Ahmad, has also made a similar appeal, and both have urged the people to follow utmost precaution to protect themselves as well as others in this pandemic situation. Eid al-Fitr is likely to be celebrated on the 14th of May, depending on the sighting of the moon. Gujarat has recorded 11,592 new cases of COVID-19 yesterday. According to the State Health Department, 14,931 patients recovered in the last 24 hours and were discharged from the hospitals. More details from our Ahmedabad correspondent.
The recovery rate in Gujarat has improved and reached up to 79.11%. Maximum 3,194 new cases reported from Ahmedabad, while Surat recorded 823 new cases. 117 patients lost their lives yesterday. With this, the death toll due to COVID-19 in the state has reached up to 8,511. Gujarat has now 1,36,158 active cases at present, out of which 792 patients are on ventilator. Meanwhile, 2,07,700 persons were vaccinated in the state yesterday. Now Gujarat has vaccinated more than 1,37 lakh persons till now. Gujarat government has suspended the state transport bus services with Rajasthan for 15 days. Yogesh Pandya, AIR News, Ahmedabad.
Bihar is witnessing continuous decline in fresh COVID-19 cases. 10,174 positive cases were reported during the last 24 hours and 15,800 people recovered yesterday. The state also reported 176 COVID fatalities. The state's recovery rate has risen to about 82%, while test positivity rate has declined to 10.16%. Over 4,93,000 people have so far been recovered from the infection. 81,81,939 people have been vaccinated in the state so far. Over 1,52,000 beneficiaries belonging to the age group of 18 to 44 years have also been vaccinated. In Chhattisgarh, COVID situation is significantly improving. The state's positivity rate is on a steady decline for the last 6 days. More from our Raipur correspondent Vikalp Shukla.
Chhattisgarh has recorded a decline in positivity rate during the last 1 week. This is for the first time after about a month that the positivity rate has fallen below 20%. So far, about 7,25,000 corona-infected patients have recovered after the treatment. The recovery rate of the state is more than 83%. Out of the total recovered patients, 81% have recovered while having treatment in home isolation. Meanwhile, the vaccination campaign in the state is also continuing vigorously. So far, more than 59 lakh vaccine doses have been inoculated. Vikalp Shukla, AIR News, Raipur.
In Andhra Pradesh, at least 11 patients died when the required pressure and oxygen supply dipped at the Sri Venkateshwara Ramnarayan Ruiya Government General Hospital in Tirupati last night. Andhra Pradesh Chief Minister Y. Jagan Mohan Reddy has ordered an inquiry into the tragedy. Chittoor District Collector M. Hari Narayanan has confirmed the death of 11 COVID patients in the ICU ward. Meanwhile, an oxygen tanker reached the COVID hospital and supply was restored. In eastern Ladakh, the villagers are playing the role of plainclothes soldiers in protecting the borders. On the line of actual control in the region, they are acting as the eyes and ears. The government is focusing on keeping those villages populated with special packages for Changsang region. This initiative is now raising hopes in border villages. Our Leh correspondent files a special story from Zero Border Village, Phovrang in Leh district.
Phovrang, a zero-border village on the banks of Pangong Tso, nearly 200 kilometers away from Leh town. Village of over 70 households include nomads and traditional farmers. Phovrang is one of the totally organic villages in Leh district, as their lifestyle includes livestock which provides them enough manure to grow crops organically. However, migration for the better opportunities from the border village are affecting the numbers of livestock and agriculture. However, village old age practices practices in organic farming are leading Phobrang village in Mission Organic Development Initiative (MODI), a program to make Ladakh an organic state by 2025. After Ladakh becoming union territory, the center has announced 245 crore rupees Changthang development package, which is mainly focusing on keeping border lifestyle and their mainstay lucrative and to keep the village populated. UT Secretary Ravinder Kumar said,
चंगथंग पैकेज है उसमें हम जितने हमारे बॉर्डर एरियाज हैं, चाहे दुर्बुक हो या नमा सब डिवीजन हो, एनिमल्स को लेके इनके सेल्फ शेड के ऊपर हम काम कर रहे हैं, फॉर्डर डेवलपमेंट के ऊपर हम काम कर रहे हैं.
Satan Tashi for AIR News from Zero Border Village, Phobrang near Pengongso.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Country witnessing declining trend in active number of COVID-19 cases. Over 3,53,000 patients recover from the disease in the last 24 hours. Over 17 crore 26 lakh doses of COVID-19 vaccine administered nationally so far. National capital Delhi's COVID test positivity rate lowest since April 16 this year. Government scotches rumours that 5G technology is causing the spread of COVID-19. Centre delivering global aid to states and union territories through whole of government approach. Odisha to import vaccines for COVID-19. Global tender to be floated to procure COVID-19 vaccines from major national and international firms. In Andhra Pradesh, 11 COVID patients die in Tirupati due to lack of oxygen supply. In Tamarind, the 16th Legislative Assembly begins today. Assembly Speaker's election to be held tomorrow. In Nepal, opposition parties start preparations to form new government after Prime Minister KP Sharma Oli loses vote of confidence in lower house of parliament. In cricket, India to tour Sri Lanka in July and play 3 ODIs and 3 T20 internationals. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
Welcome back. You're listening to the morning news. The Odisha government has decided to import vaccines for COVID-19. A proposal to this effect was approved by the State Cabinet in a meeting chaired by Chief Minister Naveen Patnaik in capital Bhubaneswar yesterday. Accordingly, the government will float a global tender soon to procure COVID-19 vaccines from major national and international firms. More details from our Odisha correspondent.
Making a reference to the first normalization of COVID-19 situation in countries like Israel, achieved through vaccination of a majority of their citizens, the State Cabinet underscored the efficacy of vaccines in the fight against COVID-19. In this light, the Cabinet decided to float global tender to ensure vaccine availability to all its people. Meanwhile, the state has vaccinated a total of more than 62 lakh beneficiaries till date, with about 1,32,000 of them having been given the vaccine shots yesterday alone. On the other hand, the state has been reporting new cases beyond 10,000 per day for the last 5 days. That has pushed the active caseload further to 94,760. Girish Chandra Das, AIR News, Bhubaneswar.
Karnataka logged 39,305 new COVID cases and 596 deaths yesterday. There are 5,71,006 active cases, while 32,188 people were discharged, taking the cumulative discharges to 13,83,285. The state conducted 1.24 lakh tests. Our correspondent says that the government is making all efforts to bring in a transparent system in the availability of beds, oxygen and remdesivir injections.
The Bengaluru South Member of Parliament Tejasvi Surya has informed that the loopholes in the COVID hospital bed booking system have been plugged. He said that the new features in the bed booking system software will prevent misuse by the vested interests. The State COVID Task Force Head and Deputy Chief Minister C.N. Ashwath Narayana has directed officials to immediately integrate the real-time data of the supply of oxygen, antiviral drug remdesivir and bed allocated under government quota in private hospitals on Suvarna Arogya Suraksha Trust portal. He said all relevant information on real-time basis will be available on arogya.karnataka.gov.in portal within 3 days. Sudhindra, AIR News, Bengaluru.
In the Union Territory of Jammu and Kashmir, the Mission Director, National Health Mission, NHM Jammu and Kashmir, Chaudhary Mohammad Yaseen has said that monthly stipend shall be paid to the final year MBBS students who would render services in various COVID hospitals across Jammu and Kashmir. More from our Srinagar correspondent.
In the Union Territory of Jammu and Kashmir, the administration has called upon the health institutions across Jammu and Kashmir to utilize the services of final year MBBS students for providing services like teleconsultations and monitoring of mild COVID cases after due orientation and supervision of senior faculty. In a communique to principals of government medical colleges of Jammu and Kashmir, a monthly stipend of ₹5,000 shall be paid to all such final year MBBS students under COVID-19 emergency response package of National Health Mission Jammu and Kashmir who work for at least 100 days for COVID care in accordance with the notification issued by Union Ministry for Health and Family Welfare. Sunil Kohl for AR News from Srinagar.
Maharashtra Health Minister Rajesh Tope has said that patients of mucormycosis will be treated free of cost under Mahatma Phule Jan Arogya Yojana of the state. Tope said that mucormycosis is a rare fungal infection which is now affecting those suffering from COVID, and medicines required for the treatment of this disease are expensive. Therefore, the state has decided to provide free treatment for this disease. More details from our Mumbai correspondent.
Cases of mucormycosis are rising among COVID-19 survivors, causing blindness or serious illness and even death in some cases, and the Health Department of Maharashtra has taken serious note of it. The State Health Minister Rajesh Tope has said that due to the expensive treatment of the disease, the patients will be treated free of cost in 1,000 hospitals in the state under the Mahatma Jyotiba Phule Jan Arogya Yojana. He said that patients with uncontrolled diabetes are more likely to have symptoms of fungal disease and dark spots are found near the nose and lips. He added that if the disease is not treated early, it can have adverse effects on the respiratory system, brain and eyes. Therefore, an awareness campaign will be launched in the state to fight the disease. Tope has appealed that the patients suffering from this disease should not panic and those who have diabetes should keep it under control, and has also urged the patients to exercise, have a proper diet and take medication on the advice of doctors. Shailesh Patil, AR News, Mumbai.
The ongoing COVID pandemic has caused severe stress to adults and children as well. Talking to AIR News, Dr. R.P. Beniwal, Professor, Department of Psychiatry, Dr. Ram Manohar Lohia Hospital, Delhi said, this pandemic is a unique situation and happens once in centuries. He said, everyone should remain calm without losing hope and being unperturbed. This too shall pass. He shared a few tips for parents to take care of the mental well-being of their children. He suggested that parents should indulge in physical activities involving children to keep them busy and active.
Try to divert our attention and try to keep busy yourself in other activities of your interest. आपको जिन चीजों में ज्यादा मजा आता है, जैसे किसी को न्यूज पेपर पढ़ने में मजा आता है, किसी को स्टोरी बुक में मजा आता है, किसी को नॉवल में मजा आता है, किसी को सीरियल देखने में मजा आता है, किसी को मूवी देखने में मजा आता है, वो अपने इंटरेस्ट की चीजों में अपने आप को बिजी रखे। एक बार आपने अटेंशन डाइवर्ट किया और एक मूवी शुरू कर दी, वो 2 घंटे तक आपको बिजी रखेगी। अननेसेसरी के अनवांटेड थॉट आपके ब्रेन में नहीं आएंगे और हमें बस उन्हीं को बचाना है।
Dr. Beniwal suggested that parents should spend time with their children so that they do not miss meeting their friends.
The 16th Tamarind Legislative Assembly has been summoned to meet for its first session today. The 234 newly elected members of the Legislative Assembly will be sworn in by the Pro Tem Speaker K. Pechandi. The inaugural session will be held at the Kalaivarna Arangam at the Omandurar Government Estate instead of the traditional Fort St. George to maintain social distancing and other COVID protocols. The Assembly Speaker's election will be held tomorrow. DMK's senior member Appawa has been nominated by the party for the Speaker post, and K. Pichandi is nominated for the Deputy Speaker's post. The government has said that over 1 lakh metric tons of food grains were distributed to over 2 crore beneficiaries by 12 states and union territories so far under Pradhan Mantri Garib Kalyan Ann Yojana PMGKAY 3. Secretary, Department of Food and Public Distribution, Sudhanshu Pandey, yesterday briefed the media about PMGKAY 3 and One Nation, One Ration Card ONORC scheme through a virtual press conference. He said the department started implementation of the scheme for 2 months, May and June this year, by providing an additional quota of free-of-cost food grains at a scale of 5 kilograms per person per month. Mr. Pandey informed that the distribution of food grains is going as per schedule for the month of May, and so far 15.5 lakh metric tons of food grains have been lifted from Food Corporation of India depots by 34 states and union territories for the month.
Major opposition parties of the Nepalese parliament have started preparations to form a new government after Prime Minister KP Sharma Oli lost the vote of confidence in the lower house yesterday. Opposition leaders Sher Bahadur Deoba, Pushp Kamal Dahal and Upendra Yadav called on President Vidya Devi Bhandari to initiate government formation procedure soon after the commencement of a special session of parliament today. All leaders from the Nepalese Congress, the Communist Party of Nepal, Maoist Centre and a faction of the Janata Samajwadi Party led by Yadav have urged President Bhandari to invoke Article 76(2) of the Constitution. Earlier, Nepal Prime Minister KP Sharma Oli lost the vote of confidence in the House of Representatives. He secured only 93 votes in the lower house of parliament during a special session convened on the directives of President Vidya Devi Bhandari. The Prime Minister required at least 136 votes in the 275-member House to win the confidence motion. Last week, the Communist Party of Nepal, Maoist Centre, withdrew support to the government, leaving it fall short of majority in the House. India will be touring Sri Lanka in July and play 3 ODIs and 3 T20 internationals. Sri Lanka Cricket SLC has proposed an itinerary which was accepted by the BCCI. 3 ODIs will be played on 13th of July, 16th, 19th of July and it will be followed by the T20 International Series running from 22nd to 27th of July. The Indian team will arrive in Sri Lanka on 5th of July and they will head back home on 28th of July. And now let's take a look at the weather forecast for today. National capital Delhi is expected to have a partly cloudy sky with possibility of development of thunder lightning. Minimum temperature was recorded at 24 degrees Celsius, while maximum will be around 39 degrees. Mumbai will have a mainly clear sky. Minimum temperature was 27 degrees Celsius and maximum will be around 34 degrees. Chennai may witness a partly cloudy sky. Minimum temperature was recorded at 28 degrees Celsius and maximum is expected to be 37 degrees. In Jammu, minimum temperature was 22 degrees Celsius while maximum will be around 37 with mainly clear sky, becoming partly cloudy towards the afternoon or evening. Srinagar had minimum of 14 degrees and maximum will be around 24 degrees. City will witness thunderstorm with rain. In Leh, temperature will hover between 6 and 19 degrees Celsius. The sky will be partly cloudy. In Gilgit, the sky will be generally cloudy. In Muzaffarabad, temperature will shift from 18 to 30 degrees Celsius in the afternoon.
And now an overview of today's newspapers. Apart from the latest on the COVID scenario in the country, papers have widely noticed swearing in of Assam cabinet, political upheaval in neighbouring Nepal, and in some international news, all dailies have prominently noticed latest strikes on Gaza by Israel. Hindustan Times writes, capital's positivity rate dips below crucial 20% level. The Tribune writes, 48 bodies found near Ganga Ghats in Buxar. On the vaccination drive, the Pioneer headlines, clamour for COVID jabs in urban India, adding various states complain about vaccine shortage. The Asian Age headlines, Himanta vows 24/7 government, urges Ulfa chief to end stir joint talks. On the political turmoil in Nepal, the Tribune writes, Nepal PM Oli loses trust vote. Hindustan Times writes, Israel's army launches airstrikes on Gaza. And finally, the Pioneer writes, postmen give new lease of life to serious patients in the time of crisis. Dakiya Dawalaya is the new role taken up by the postmen of Moradabad.
And now, before we end the bulletin, the headlines once again. Country witnessing declining trend in active number of COVID cases. Over 3,53,000 patients recover from the disease in the last 24 hours. Over 17 crore 26 lakh doses of COVID vaccine administered nationally so far. National capital Delhi's COVID test positivity rate lowest since April 16 this year. Government squashes rumours that 5G technology is causing the spread of COVID-19. Centre delivering global aid to states and UTs through whole-of-government approach. Odisha to import vaccines for COVID-19, global tender to be floated to procure COVID-19 vaccines from major national and international firms. In Andhra Pradesh, 11 COVID patients die in Tirupati due to lack of oxygen supply. In Tamil Nadu, the 16th Legislative Assembly begins today. In Nepal, opposition parties start preparations to form new government after Prime Minister Oli loses vote of confidence in lower house. And in cricket, India to tour Sri Lanka in July and play 3 ODIs and 3 T20 internationals. And with that, we end the morning news. Have a great day.